Hi folks, welcome to part 2 of our mini lecture on opiates. Where we left off was discussing in brief the history of opiates, specifically opium, which again is derived from the opium poppy, Papaver somniferum. Opium has been used in cultures such as the cultures of Babylonia, Assyria, and Sumeria, dating back 5,000 years. It's also one of the most widely traded and used substances in cultures such as the cultures of Asia, Europe, the United States, and even Egypt. In the United States, opium was a major ingredient in many of the over-counter medications prior to the FDA, and it was the average housewife who was the major 19th century American consumer of products containing opium. We could also say that of benzodiazepines, specifically when they were introduced into the market during the 1950s. So it is morphine that is the active ingredient in the opium poppy. It was first purified in 1805, and then later in 1853, the hypodermic needle was invented by Alexander Wood. So the first wave of addiction to injectable narcotics, specifically morphine because heroin was not around yet, occurred following the American Civil War. And then it was later in 1898 that Bayer Corporation, like Bayer aspirin, discovered or invented heroin. So they did this by adding an extra chemical group onto morphine, and when they added this extra chemical group onto morphine, they discovered that it made it more fat soluble, thus allowing it to break the blood-brain barrier quicker, and so enter into the brain quicker and have a stronger and quicker effect. It's now being researched as a plausible pain medication for patients suffering from terminal cancer, because as of right now, heroin is still considered a Schedule I substance, meaning that it has no medicinal value. Heroin, the name heroin, was actually the patented name by Bayer Corporation, and now has become the commonly known name for this substance on the street. So, as we know, opiates are still a popularly prescribed pain-relieving medication. However, they are highly addictive. During the late 1990s and early 2000s, it was told to many doctors, both through the FDA as well as from pharmaceutical companies, that opiates weren't highly addictive and that it was okay to heavily prescribe opiates to their patients. During the time that Buzzed was written, the statistics showed that 90% of people abusing opiates were using opiates that were diverted medication. Again, medication who was prescribed to someone for a specific reason and then either sold, given away, or stolen and used by someone else. I would say that that statistic is now different, probably lower than 90% of people are using diverted medication because the FDA has created stricter prescribing guidelines, and now this is part of where we're getting this this big boom, this opiate crisis, this opiate epidemic happening from both the diverted medications as well as the increase of use of street versions of opiates such as heroin. So some use the term opioid to describe opiates. The difference is that opioid refers to both opiates as well as to drugs resembling the opium poppy and the natural endogenous opioids. So we do all have natural receptors for opiates in our body. And it's the same way with the endocannabinoid system that we discussed with cannabis. There is the endogenous opiate system in our body. So opiates act on specific receptor molecules for the class of the neurotransmitters known as endorphin or enkephalin class. So these are the chemical neurotransmitters that control movement, mood, and other physiological processes like digestion, regulation of body temperature, and of course breathing. These neurotransmitters also process pain sensations and activate the reward circuits in our body. So typical Typical activation, of endogenous opioid neurons is rare. It occurs when we're in pain or in small amounts when we're experiencing very pleasurable activities. However, taking heroin, on the other hand, is like every endogenous opioid neuron in the brain firing at once. So there are many different types of endogenous opioid neurons in the brain, and the main opiate receptor is named mu, from the Greek mu. And it provides the major effects of the opiates, the analgesic or pain-relieving properties, the euphoric, as well as the respiratory depression properties. So however alluring opiates may sound or feel, there is no way to separate the pain-relieving effects and pleasurable effects from the addictive properties. And this is part of what makes it so addictive, is that people feel really good when they take it, and they like that feeling, and then the withdrawals are described to be quite horrendous. Research is actually showing that one of the main motivating factors that feeds addiction is that people are trying to avoid the withdrawal symptoms. If you've ever heard someone say that, they're just using enough to get through the day, they're just using enough so that they can go to work, because the withdrawal effects render them disabled in a way from doing any other type of work. So, even just taking opiates for a few weeks can cause dependency and withdrawal to occur. The amount of opiates that you take, the type of opiates that you take, and the amount of time that you take them for will all affect the level of dependency that a person reaches. And then there are many factors that will determine when and how a person becomes not dependent on that substance, which is different from being addicted. A person, like a baby for example, can be physiologically dependent upon the substance, but that doesn't necessarily mean that they're addicted to the substance in a behavioral sense. So this is where studies on animals can come into play and can teach us a little bit about the different ways that a person becomes tolerant to a substance and the different types of medications that can be helpful when a person is trying to clean up or trying to withdraw from the substance. Because research is showing, again, that people are more likely to seek out the drugs just to avoid the withdrawal symptoms than they are because of their pleasurable effects. However, it is important to note that when a person becomes addicted to a substance, physiologically dependent, that there are two major changes in the brain that affect this process. And one of those changes is that the brain's reward system, it becomes trained to respond to certain triggers, maybe certain phrases, certain environments, certain people. So for example, a person who may have been addicted to opiates at one point in their life might have a challenging time revisiting the places where they used to use these substances, hanging out with people that they used to do these substances with, or even just talking about the substance or looking at a picture of the substance would be enough to trigger a response, to trigger a craving, because of how being addicted to the substance changed that part of the brain. So in addition to that, when a person is coming down from the substance, when the drug is wearing off, the part of the brain that fires the neurons that elicit fear and anxiety actually intensifies and increases. So for a person who may not have been addicted to opiates but is using them because they had a surgery, they might feel a little bit of the withdrawal effects, including the anxiety, but not to the extent that someone who was an active user, who was actively addicted to the substance would. So again, becoming addicted to the substance creates brain changes that make for triggers in the environment. A person may get sweaty palms, their heart might start beating, they have the strong cravings, as well as having the anxiety and the fear that go with withdrawing from the substance. So what about withdrawal is so bad, right? So here's a list of some of the opiate withdrawals. It is described as being really horrendous and miserable. However, again, withdrawing from opiates is not lethal necessarily, especially in comparison to withdrawing from a substance such as alcohol or benzos. So some of the withdrawal symptoms that occur would be runny nose, runny eyes, sweating, shivers, diarrhea, because again, as we learned before, taking opiates causes constipation. So when the opiates are wearing off and they're not affecting your body anymore, the opposite effect is going to occur. People report having muscle pain, abdominal cramping, increased sensitivity, insomnia, irritability. So again, runny nose, watery eyes, abdominal cramping, diarrhea, muscle pain, chills, shivers, shaking, irritability, to the point of where people think that they're going to die. They feel like they're going to die. It's like having, the worst flu you've ever had in your life and then some. However, the likelihood of dying from withdrawing from opiates is much, much less than the likelihood of dying from a fatal overdose, as well as less than the likelihood of dying from withdrawing from alcohol or benzodiazepines. So again, this was part 2 of our mini lecture on opiates. Please make sure to read the chapter associated with this in Buzzed, as well as the links provided. And if you have access to National Geographic or Netflix, please watch the episodes about heroin and fentanyl that are part of the show Drugs Inc., because they're going to be able to show you an insider perspective into the drugs and the drug trade on the street that I'm unable to show you from here. So as always, if you have any questions, let me know. Have a great day.